We moved into this office about 7 weeks ago, so if the doorknobs fall off or anything, just let us know and we'll glue them back on. We're very happy to be in this new office. Our malaria vaccine initiative, which was housed in Bethesda, and our other DC programs, which were down on K Street, both grew out of their offices at about the same time. So we took advantage of that to combine them into one new office here. So we're very happy that our malaria vaccine initiative team and our other vaccine development teams are now co-located here in the Washington, D.C. office. So I think this is one of our first public events. So thank you all for coming and for finding us at our new address. Today's event is co-sponsored by PATH and the Medicines for Malaria Venture, as well as the Global Health Technology Coalition, which I know many of you are members of. And so the Global Health Technology Coalition now has in excess of 30 members, really bringing a coherent voice on important issues around regulatory planning and innovative financing and support for research and development in the global health technologies arena. And so we're very happy that the coalition and PATH and MMV could bring you together this event today. We're very happy to have with us our planned panelists, including Ray Chambers, the UN Special Envoy for Malaria, as well as David Reddy, the relatively new CEO of the Medicines for Malaria Venture, and Christian Luke, who's the director of the PATH Malaria Vaccine Initiative. And as a special bonus today, we have a fourth panelist, Rear Admiral Tim Ziemer, the U.S. Global Malaria Coordinator, who's agreed to join us on the panel and make a few brief remarks. And what we really hope to do today is to have a fairly informal discussion. We'll have each of our panelists make some comments, and then we're really going to open it up for questions from all of you and have this be interactive. We have no one using PowerPoint slides, so you'll all be relieved at that. So let me just thank you all again for coming. I should mention that we took advantage of the fact that the Medicines for Malaria Venture North American board meeting was held here at our offices at PATH today, and so we've had a number of the senior staff of the Medicines for Malaria Venture from Geneva are in town with us for this, as well as our other MMV North American board members, in particular Jim Garrity from Genzyme in Boston and Wendy Taylor from USAID, joined myself and Dennis Schmatz, who's here somewhere, there he is, Dennis and I are both on the board of the Medicines for Malaria Venture in Geneva. And Ray Chambers is now the chairman-elect of the MMV board and will be joining in that position in June of this year. So we had our board meeting this morning. We thought we would plan around that, an opportunity to engage in a discussion with you about new tools on the horizon for fighting malaria. What I'd like to do is to really have our panelists give us a sense. I'm going to turn first to Ray and Tim and have them talk a little bit about the progress that's been made to date. And there, as I think many of you know, there's been considerable progress made to date in the control of malaria using existing tools. There are many countries in Africa where we've seen over 20% drops in the malaria prevalence. Some even more impressive gains with up to 40 or 50% drop in malaria prevalence. We're making a tremendous amount of progress with today's tools. But there are still over 800,000 people a year who die from malaria, most of those children under the age of 5. And we certainly at PATH and at MMV feel that having new tools in the pipeline for dealing with this problem for the medium and long term is going to be important to complement the short-term gains that we've seen, the gains that we've seen in the short term using existing tools. So let me turn it over first to Ray, perhaps, and get a little bit of comments from his perspective as the UN Special Envoy for Malaria about progress to date and the importance of new tools on the horizon. Ray?